Thank you for giving me the opportunity to come here and speak. My name is Steinar Pedersen. I'm a trained doctor. Actually, I was studying medicine in Belgium, early 70s. So when I hear you speak in Dutch, I can hear every second word. But I have forgotten my words. And it was also interesting to hear about what you're talking about standards. So I'm going to talk a little bit about standards. I'm going to talk about some of the activities we have in Norway. But I will also try to talk about some of the trends that I see around us in society and see how I think that would influence our way of thinking. This image is from 1969. It was the man on the moon. There is about 38, 39, 40 years ago. This machine, to enable that, they had 7 computers inside. And those 7 computers, they had to talk to each other. Otherwise, they wouldn't find the moon. They couldn't land there or not. Things have moved on, and I'm still fascinating traveling. I'm traveling a lot. You can go into a bank wherever you go in the world. You put 4 digits, and if there is money on the account, money is coming out of the wall. And that is standardization on a very, very nice, user-friendly level. It's working globally. When it's come to healthcare, it's something like this. It's just a burden to the patient. The healthcare system is working up front. I say we don't care about how this should be done. For me, standardization is just like you said. It's about a plug. It's the other part. It should fit together. So it's just, that is for me standardization on a reasonable frame level. Because what somebody had agreed upon is that currency should go into the wall. It have to fit like that. It's competition where you buy it. It's cheaper wherever. You don't have to own it. You just rent it. And then you have the TV. It's totally unthinkable that anybody should try to get to the market and the plug doesn't fit into the wall. So what do we see then? We have a lot of competition on buying Hitachi, Sony, whatsoever, and there's a lot of competition in what kind of programs. So somebody had decided that it's going to be like that, and it's going to serve us, and we have it in every home. So the new Norwegian Minister of Health, he had said that I'm taking the standardization body in Norway. I'm sick of tired of all these kind of discussions. I'm taking that standardization body into my office. I will put you on my knees, and you have to decide something like that. Frames like that, and within that, I want a lot of vendors to come and compete to the best of the healthcare market. So I'm pretty optimistic when it comes to standardization's work in Norway. But we have been struggling for years. If you see the position in Norway, all the Norwegian general practitioners are using an electronic patient records. All of the hospitals are using an electronic patient records. But until recently, they have not been able to communicate with each other. So what they have done is they have taken the paper and put the papers into the PC, digitized the past. Where I'm coming from is Tromsø. It's something called the Norwegian Center for Telemedicine. It's been in work since 1992. We do research and development. There are a staff of 110 persons. Out of them, 40 are busy with their PhD. We are also working as a WHO collaborating center for telemedicine. And 2 years ago, we won a competition and became a center of research-based innovation where the Norwegian Research Council pays us 10 million euros to do research in connection with industry for the next 3 years. So I'm going to talk a little bit about what we do today, trends, and the future. When I left Tromsø, by the way, the sun was shining 24 hours a day. So a few words about the Norwegian healthcare system. There are 4 regions. Each of them have a university or regional hospital. There are 70 local hospitals and 2,000 GPs offices, around 10,000 doctors. 4.8 million inhabitants with 4.8 million subscriptions. So all of the Norwegians have access to the nest, using the nest. The healthcare system is 99.9% public funded. We pay nothing out of the pocket. It's paid by the taxes. We don't have private insurance to fight with or against. Equal access to healthcare wherever you live, and we try to put it at the lowest effective level of care. And once again, I'm not rallying for the Norwegian Minister of Health, but we have a very powerful guy in the office, and he had decided that 10%, that means 10 billion euros is going to be taken out of the hospital's budget and given away to the municipality to buy healthcare services back. So we have started to create plans for the municipality, asking them the question, why should you pay a hospital director 1,000 euros a night when it's possible to pay 100 euros a night and use the patient's bed at home and put some technology in between? And they see the potential of huge savings. So I'm looking very much forward to what's going to happen in the years to come there. We have had national plans, and one of them was to create a healthcare network dedicated to the healthcare system. This part, northern part of Norway, Tromsø up here, the municipality's responsibilities is for the GPs. The regional authorities are for the specialists. But what the regional authorities here said that, okay, it's not our responsibility, but we will pay for all the doctors to be connected on the net. So they took out of the pocket and put on another administrative level. And that created a huge step ahead. So in northern part of Norway now, all the requests, all the reports, lab results and everything is floating electronically between the players. And this is also going to be the case in the rest of the country in the next 18 months, I think. Another thing is that we have also been able to convince our Minister of Health that access to the net is the same as having access to a channel, have access to the road. It's a part of a modern national infrastructure. And they accepted that, and they're going to pay for the municipality to be linked and the doctors to be linked on the net. So we started out with a lot of video conferencing services within nose and throat, pathology, dermatology, psychiatry, cardiology, dermatology, and so on. That was a starting point. We have now moved more and more over to, as I will show you, attachment to emails. But this one service, that's heart sound, taken from a newborn baby, put as an attachment to an email and sent to the specialist. And in that way, 99 out of 100 small newborn babies that they thought had heart murmur that was pathological were taken out of the queue because it's not. It's a normal heart sound, but the doctors, in case, thought it was so. Another example is that these are patients with dialysis, meaning that their kidneys has been destroyed, so they have to clean the blood 5 times, 6 times a week. They'd have to travel from a general practitioner to a local hospital, or from a local hospital down to the university hospital. Now all the equipment have been placed in the general practitioner's office. The nurses has been specially trained. All the things are going on locally, and the vital sign is transferred to the screens at the university hospital. These doctors at the university hospital, they go virtual visitation every day at 11 o'clock at the general practitioner's offices. And that has created a new sort of organization where the GPs and the university hospital work very, very closely. And you can think of asking the patient, would you like to travel as in old days, or do you like to do this where you are? And the next step here is to bring this into the patient's home, do the dialysis through the night time. Another example here is, should move, doesn't, but it's midwives taking an echo Doppler of a maternity control and send the images from here to there. From a technical point of view, it's working perfectly well. From an organizational point of view, it's not working at all, because the gynecologist here says that the midwives are not good enough to do this kind of work. They feel they are challenged in their position. And we see that in a lot of areas where we try to introduce telemedicine.